Yes, welcome everyone. We are going to discuss marketing, public health, or what you can call public health marketing. Sometimes you can call it social marketing. So in this presentation, you'll know um, how we can apply principles of marketing in a commercial environment to marketing in in public health. Of how do we make sure that we can basically contribute to positive health outcomes using our public health interventions? How do we make sure that people can adopt healthy behaviors uh, if we use the proper marketing strategies? So we'll look at how to design a public health marketing strategy or plan, and then see how we can implement it and even be able to evaluate it. Okay, but for all this kind of planning implementation, we also need to be aware of the ethical issues that can arise. So those are the things that we are going to look at in the marketing public health interventions. So when we talk about marketing public health, we are basically referring to the process of applying marketing principles and strategies to protect and promote the health and well-being of the population. It is different from the usual marketing. The usual marketing of either marketing your product. Let us say you are making cookies, so you sell these cookies to customers, or you're a person who has a salon, then you're marketing your salon, okay? Or you're a person who sells any other item or service, provides any service. So for it, it is basically focused on seeing a change in attitudes, knowledge, and behavior. Okay, we want people to have knowledge that can enable them to improve their health. Okay, so we are focused on attitude change, uh, knowledge acquisition, then also behavior change for communities and populations where we work in. So that is marketing public health. It is not really any different from what we call social marketing. Okay, so where you see the word social marketing, it basically refers to the same concept. It is not so much different. It's about applying commercial marketing principles in a public health arena. In the public health arena, we are concerned with protecting, promoting health in communities and populations. So it means we apply uh, social marketing across all public health interventions. So social marketing for vaccination campaigns, social marketing for hand washing campaigns, social marketing for breast awareness campaigns, social marketing for utilization of family planning. Okay, so we have a number of public health interventions that we can apply social marketing or public health marketing principles. But basically, the two come from commercial marketing. Okay, so the commercial marketing principles uh, are the ones that we really apply, and we'll look at what these principles are and how we will apply it. So, if we know the techniques of marketing public health or marketing or social marketing means that we shall be in position to design appropriate awareness campaigns. We'll be able to target our campaigns. If we say appropriate campaigns in terms of marketing perspective, we mean that you will know how to craft the message. You will know how that message should be delivered, what channel to use. You will know how to evaluate this campaign. You also have the appropriate metrics for monitoring and evaluation. Okay, so if we know the basics of marketing in public health, it means you will be able to do that. Some of the public health interventions actually fail because of poor marketing. Okay, for example, the uptake of family planning in our communities is actually low. Part of the reason is because we have, of course, cultural barriers, issues to do with lack of awareness, low knowledge, all the things about family planning that have prevented people from taking up the services. But a well-designed family planning campaign should be accompanied with a well-designed social marketing campaign for family planning. Okay, so you'll be able to know how to basically spread your message out there about family planning, and then people will embrace the services. Okay, so if you apply the appropriate marketing techniques, you have higher up. Of course, you create awareness, people will get knowledge about the services, the attitude will change, they will start adopting the appropriate behaviors. Also, they will continue, they will use, the utilization rates will increase. Okay, and then of course, overall, you will have improved the health outcomes. So that means that for every intervention that you design, you need to have a public health marketing strategy. Okay, and we have said that this usually uses commercial marketing principles. Okay, so for you to have a comprehensive strategy, you need to take note of the following. The first, you need to conduct a situation analysis. Okay, you need to know the prevailing circumstances within the organization where you're designing or implementing this public health intervention, or the external environment. Okay, so you need to conduct an analysis. For internal analysis, you basically look at what resources do you have. So in terms of financial resources, you also look at in terms of human resources. Then you also look at the knowledge, the expertise in that field, and then the potential collaborations and partnerships that you have. Okay, so you basically evaluate your organization and see if you are actually well equipped to undertake a social marketing campaign. Okay, and then you look at the external factors. You can look at the social, economic, technological, political, and legal factors that can impact the campaign that you want to run. If it is about GBV, okay, You need to understand the social, economic, technological, political, and legal implications of running such a campaign. Okay? And then see whether you have a competitive edge, or even whether there are other agencies doing the same. Okay, so you need to look at the external environment. So using all the factors that you have analyzed, you can come up with a SWOT analysis, which is basically looking at the strength, weaknesses, opportunities, and threats. So basically, after looking at the internal and external factors, you can categorize these factors to whether their strength, weaknesses, opportunities, okay, or threats. Okay. Usually we say that the strength and weaknesses are internal, and then the opportunities and threats are external. Okay, the ones that you don't have control over, external, and then those that you have control. Okay, so your marketing strategy or plan should have that in place. And then you formulate your objectives. If you're going to run an awareness campaign on modern family planning methods, then you should have the objectives for which you will use to gauge whether you're progressing well. So these objectives have to meet what you call the SMART criteria. Is specific for the S, measurable for the M, attainable for the A, then relevant finally. So specific, an example of a specific objective is if it is about vaccination, then you can say that the campaign aims to increase the vaccination rates amongst children aged young children to young adults aged 18 to 25 by 10% within 6 months. Now, for you to have an objective like that, you need to have what you call the baseline data. Means before you start the intervention, what is the vaccination rate? Okay, and then after 6 months, you can now calculate the increase that you have had. So you need to have baseline data. Okay, and they should be measurable. This can allow you to really track the progress that you're making. So you can have what you call counts, basically numbers or proportions. Okay, if you say that at the start of before the intervention had started, 4 in 10 women had ever used family planning. And then later on at the end, say we now have 7. Okay, so that quantitative figure is very important. It gives you a proper metric for tracking progress. And then attainable, you don't necessarily need to set objectives that you really know that the resources will not allow you to achieve them. So they should be achievable or they should be attainable. And then relevant. If it is about improving public health. If the intervention is about um, creating awareness on breastfeeding, then the objective should really be related to public health issue that you're really talking about. So it should be relevant. And then time bound. You should make sure that your objectives can be really tracked within the time frame that you have. Other concepts that you need to be aware about, concepts to do with segmentation, targeting, and positioning. Segmentation is about dividing the target population into groups that share specific or particular characteristics. If you're going to run a family planning campaign, then you really need to tailor that campaign to women of reproductive age. Okay, that is basically target. A segment. Okay, but you can also make sure that the message or the campaign really captures also the men, because the men play an important role in the utilization of family planning. Okay, so segmentation is very, very vital. And then now, after you have chosen the segments, now you make sure that your campaign focuses on them. Okay, so you allocate resources strategically. That is basically targeting. Okay, the message should really be targeted. And then positioning. Here, you basically craft a unique message and a value proposition that resonates with the chosen target segment. There is a way you want that segment to really recognize you, recognize your message, okay, such that your campaign really stands out and can be differentiated from other existing messages. And with this, you also need to take into consideration of highlighting the specific targets for the specific benefits for the target audience. So earlier on, we talked about the commercial principles of marketing. The commercial principles of marketing basically rely on the 4 Ps. Okay, they rely on the 4 Ps. But these Ps, depending on the resource that you read, they can be increased to 5 or even 7. So it doesn't mean that they are only the 4 Ps that you're going to look at and the ones that will apply. So the first P is the product, which in this case, we're actually putting it in quotes because it is not really the product in our case. We want people to adopt a behavior, and that is what we want. It's like our product. Okay. So if it is about family planning, uptake, if it is about going for breast cancer examination or screening, or cervical cancer screening, or people delaying a marriage, that is a campaign about preventing early child marriage, or a campaign about stopping harmful traditional practices. That is what we are selling. So it's like our product. Okay. So that is the first P, product. The next one is price. Okay. With this, we look at it in terms of the associated cost. and the cost associated with change in behavior. Okay. And in the commercial marketing, when we say that we are going to open up a school, one of the things that you are going to look at is how much school fees should they pay. That is the price in that commercial setting. But when we talk about the social marketing setting, when we talk about the price, we think about the issues or the costs that the client may have to incur if they are to adopt what we want them to adopt. Okay. So, for example, when we have a campaign to make sure that people who have been diagnosed with tuberculosis come to the hospital and take their medications. The medications will be taken for 6 months, usually. And if they don't take this medication accordingly, that is adherence, they can we can have issues of multi-drug resistance TB. Okay, so you really want them to come regularly and get their medications for the 6 months. Now, the patient will tell you that I really want to take this medication, but I don't have costs for transport to come to the hospital and pick these medications. Okay, so as a public health person, you can see that the cost of making sure that they take their medications accordingly is about the issue of to do with the transport. So you can have an incentive to provide them such that they can really uh, come, and they don't have any excuse for them not to come. Okay, so that is the cost. If it is about cervical cancer screening, you tell people that you go for cervical cancer screening, and then you have not considered the fact that the cervical cancer screening will take, let us say, 30,000 SSP. They will listen to your message, but they will not come because they don't have that 30,000 SSP. Okay, so as you're designing your campaign, you need to look at the price or the cost that the population can incur in seeking the service. Okay, so as you think about that, then you tailor your program to make sure that you remove that cost. Or if that cost is there, it is a minimal cost. So that is where you now move the screening to their community. That is when now you say, okay, when you come for the screening, you go back with a kilo of sugar. Okay, so they will know that they will spend 5,000 to come for the screening because the screening is free. It's just that 5,000 is for transport, and then when they go back with a kilo of sugar, they will see that okay, at least there's something that I can get. So those things, those benefits um, provided in these public health interventions basically use that principle that you see people will think about the cost, and it may not necessarily be the cost. You see, the cost can be interpreted in terms of money, but the cost can be interpreted in terms of pain. Okay, the discomfort that the procedure causes. I could have liked that procedure, but cervical cancer screening is very, very painful procedure. Okay, so that pain can be the real pain that you feel, or that pain can be uh, an issue where they have to weigh whether they have to leave work and go for screening. Okay, so the time factor also comes in. That's when now you design your campaign. Say, anytime you come, whether it is weekend, whether it is beyond working hours, we can still carry out the procedure. Okay. So you remove those discomforts associated with them undertaking the intervention you want. The other P is the place where. Okay. Where eliminates a number of areas. Where is the cervical cancer screening going to take place? Is it going to be within the community or is it going to be far away? Where also looks at where are you going to pass the message? Is it through the traditional media channels or through the digital platforms, social media, websites, and blogs, things like that? So, place is very key. So, how am I going to promote the campaign? That is the last P. Okay, are you going to use what we call word of mouth? Are we going to use football occasions? Are we going to use social gathering meetings? Okay, what channels are you going to use? Community radios? Okay, so how are you going to promote the message? This is where you see issues to do with the posters around health facilities. This is where you see billboards. This is where you see the radio adverts, television, newspapers, and then social media. Okay, but another key important thing to include or to consider in your promotion activities is what we call a call to action, which is basically that what do you want the person to do? Okay, so you craft your message. You say cervical cancer, um, if detected early, the chances of surviving are increased. Okay, so you're basically encouraging them to go for cancer screening because the benefit is that the chances of survival are if it is detected early enough. Now you need to tell them what to do. Okay, that is what we call the call to action. What to do. So after they have read this message, what should they do with the message? That is the call to action. So you can say this is the nearest primary healthcare unit and be screened. Okay, that is what we call the call to action. So that's the last P. And then the other aspect, if you have designed your campaign, everything is in order, you have taken baseline data, you have determined your, of course, before you take your baseline data, you must have defined your um, indicators, okay, which we have looked at, their characteristics. So now, throughout the campaign, you collect data for monitoring and evaluation. Okay, this is very important to see if the project is working very well. It is also very important for convincing people that even donors that you see the intervention is impactful and it is effective. Uh, so the things that you look at, the as part of your indicators, inherently part of your indicators, you look at the number of people that the message has reached to, and then the number of people who have already taken up the service. If it is vaccination, what are the vaccination rates? If it is about prevalence of family planning, how many have now taken family planning? How many people have read the campaign messages? So how many times has the adverts running on television and things like that? Okay. Then in terms of behavior change, how many people are willing to change? How many people have actually changed? Things like that. And then you can also look at indicators that relate to improve the health outcomes. Okay, if the campaign is about teaching mothers how to make ORS, okay, oral rehydration salts, you should be able to see the reduction in number of children who die of diarrheal conditions or because of dehydration. Okay, so you see an improvement in that health outcome. So that is monitoring and evaluation. Crafting your campaign in a way that is ethical is very important. Look at the message. Is it culturally sensitive? Okay, you need to make sure that your message does not cause issues in regards to culture, and it is truthful and transparent. Okay, um, respect, which is basically about respecting people's cultures, norms, and values, and inclusivity. That means that you don't want to create a message that discriminates, then making sure that in your campaign you don't release personal data. Issues of confidentiality can be breached in that case. So let's consider a case for family planning, how you can use the marketing principles for a family planning campaign. What are the considerations? Some of the things we have already talked about. It's just a matter of just emphasizing. Then understand the audience. That means market segmentation and targeting, very important. Craft the appropriate messages. Take into consideration the cultural sensitivity, inclusivity, whether the messages should be accurate, will be crafted in a way that people really understand the message easily, and should include the call to action. Using visuals and storytelling can be catchy. Those are the considerations in messaging. Choose the right channel. The right channel will depend on the target audience. Of course, your resources. You want to use online and offline platforms, the decision is yours. But also consider forming partnerships. Okay. Uh, if, for example, we're talking about family planning interventions, you know that there are some organizations which are already running these campaigns. Why don't you form partnerships with them? That's something you really need to consider. And then implement the marketing mix, basically using the P's that we have talked about. Have your SMART objectives, implement, and evaluate. Okay, so that marks the end of this presentation. I hope it has been meaningful to you. It's time for questions.